Hello and welcome everyone to our conversation with researcher Katie Greenland. I am Dr. Liz Corcoran from the Down Syndrome Research Foundation, and we are the UK's medical research charity for people with Down syndrome. This year is our 30th birthday, so we formed 30 years ago, and I'm so excited that we can talk about this research together with you, Katie. Katie, tell us about who you are and what university you work with.
Yeah, thank you so much for having me, Liz. My name's Katie Greenland. I work at the London School of Hygiene and Tropical Medicine, and I'm in the International Centre for Evidence in Disability Research.
Thank you. And thank you for joining me today, Katie.
Thank you.
So, yes, let's talk today about the study that we funded, which was looking at menstruation in young women and girls with Down syndrome. So, I'm going to kick off with some questions. And Katie, just tell us a little bit more about what first led you to investigate menstruation in among teenagers with Down syndrome. And like, why do you think this topic is so overlooked?
Okay, thanks, Liz. Yes, well, I chose to work on menstrual health because I was hearing so many different things about it. Lots of mums with daughters who are, approaching menarche, which is first period, were really worried. And I was hearing people say, what's going to happen? How's she going to cope? And then I heard other people saying, "Oh, I've heard it's not really a problem. I don't think people really have a problem." So I thought, well, what's true and who is it true for? And what's the range of experiences? And the more I started looking into it, I realized there were really a lot of knowledge gaps. And the first thing we needed to do was simply just describe the range of menstrual health experiences and challenges that our young people are facing, as well as their families. And then we can better understand if anything needs to be done to improve their menstrual health. Um, you asked why I think this topic's been overlooked. Well, menstrual health was overlooked as a topic in general until quite recently. It's a women's health problem. There's a lot of stigma around menstrual health, but these things are gradually changing, and there's been a lot more attention and research in menstrual health. But evidence on menstrual health of people with disabilities is much more limited. And the research that's out there is quite outdated and describes things like sterilization. And there's really not much current research out there. And why? I mean, this is a more general answer, really, is that people with disabilities are generally underserved and under-researched in health for many reasons. They have barriers to accessing healthcare. There are also a lot of assumptions made about capacity and whether or not people can provide informed consent, which is necessary for research studies. And sometimes I think people fear including people if they are not used to working with people with disabilities, or they fear their underlying conditions or medications might complicate how they would interpret their data, so they just exclude them altogether.
Thank you. So, what was unique about your research project and your methods that you used?
Thank you. Well, it was simple in many ways because we did a national survey, an online survey of caregivers, and we followed that up with a series of interviews with young people and with their families and with their professional caregivers. I think what was unique about this was that it's current. There's really not very much recent research being done at all. And also, most of the research out there does not include the direct voice of people with disabilities. In this case, are people with Down syndrome and teenagers. We also had an advisory group, which was comprised of young women with Down syndrome, caregivers of people with Down syndrome, as well as medical professionals. And I think the combination of those things meant that we were able to really ask relevant questions that mattered to the community. And then during the interviews, make sure that we used a lot of participatory methods so that we were really able to ensure that we were able to learn from the young people as much as we could.
Wonderful. And I think we found it really compelling, the element of co-production being there from the beginning in this study. So thank you so much, Katie. So what were the biggest challenges or concerns that carers and families described during your research?
So we asked them about pre-menarche, so before their daughter got their first period, and then about current experiences. And pre-menarche, about 96% of our caregivers had concerns. Hardly anybody said they had had no concerns. There were a lot of worries about how they would cope with the sight of blood, about practicalities of menstrual care, so using products, managing personal hygiene, as well as how people would cope when their understanding perhaps lagged behind their physical maturity. So their body was changing, but would they understand why and what was happening? But then after menarche, so once periods became more established, generally levels of concern about all of these things really reduced. But still, about half of caregivers were worried about things like the practical aspects of menstrual care and then menstrual related pain and communication about pain, as well as the impact of hormones on mood and behavior. And a lot of these things were particularly concerns for caregivers supporting young people with higher support needs. There were also challenges around identifying pain when it's presenting as perhaps behavior,
Mm.
particularly thinking about all of the other people working with our young people and whether they realised that it's pain that's been experienced.
Mm. And that's something we've seen echoed through other physical, situations where behavior that's trying to communicate pain is then labeled as challenging behavior instead of investigated. Yeah, that's so important.
Mm.
So, were there any findings that surprised you or changed your assumption about menstruation and Down syndrome?
I think I didn't really know what to expect. I was hearing so many different things. I just wanted to understand what the actual picture was. I think something that was quite surprising was that girls really were coping pretty well with the onset of periods. Many or most were just taking them in their stride, and that was something that was really surprising caregivers. I think it was also really nice to see how many girls were pretty independent, especially those who'd been menstruating for a number of years. And one of the real reasons for this was use of period underwear. This meant that girls could put on the underwear before going to school, and then often manage or not even have to change the underwear during the school day. I was also surprised a little bit about understanding and knowledge about the timing of onset of periods. So some people thought, oh, well, everything happens late with Down syndrome. They'll get their periods later than their peers. While others thought, okay, I've heard that people with Down syndrome, start their periods really, really early. And actually what our survey showed was onset of periods was around age 12, which is the same as general population in the UK, and it's similar to what other studies have shown as well. So a lot of people just didn't know this, so didn't know really when to expect that periods would start.
That's really helpful. So, a lot of the mythology that's out there, we now understand some answers to.
Mm.
Great. Okay, so how do menstruation experiences for girls with Down syndrome differ from those of other teenagers? Like particularly around communication, independence, or like emotional well-being?
I think one of the key differences is that more practical support is required, and particularly in the beginning with changing products and personal hygiene, and just generally taking time to get used to products. So starting sensitizing early, and then some challenges around social appropriateness.
Mhm.
Um, and what was being communicated about periods more widely to the class or wider family members. But yeah, generally people were becoming reasonably independent as periods were establishing. And then I think less support was required than you might expect at school. So while support was still required in many cases, many girls were able to manage residential trips without their parents there while they were on their periods. Um, and then I think the key thing that we were seeing is just really, as we see with Down syndrome, just the range of experiences, right? So while a lot of people were not experiencing a huge number of challenges, um, nearly all the challenges were really compounded for those with higher support needs. And these are really the young people who were struggling more with communicating when they're in pain, And then a lot of this stress was really affecting the well-being of their caregivers and the whole family, with around a third of caregivers saying that they sometimes felt really overwhelmed about the practical support and mental load and everything else that came with just constantly thinking about managing what needed to be done, and thinking and worrying about whether or not their child was in pain and how much pain they were in, and whether or not they were able to effectively identify that and manage that.
And that was particularly seen in that subset, the more complex people with Down syndrome that have maybe dual diagnosis or other kind of conditions going on. Okay.
Mm-hmm.
So, what practical advice then emerged from the study that could be immediately helpful for like parents, caregivers, teachers, support workers? What can we say to them?
I think one of the things, particularly for to parents, is to say, don't worry so much about it, which is easier said than done. But with preparation, or even just knowing, and one caregiver said that to us, if she'd even known, not that it would be fine, because no one can say that, but
Mm.
that for a lot of people it is fine, that would have really helped her in thinking about the level that she worried before her daughter got her first period. And that particular individual, has quite limited, communication, but still, had taken it really in her stride. Another thing I think practically that's really useful for people is, if they aren't already aware of and using period pants, is to investigate them. Some people said, it could be a little complicated with dexterity issues, or in winter when you have lots of clothing and at school and you're trying to, you're wearing tights, and if you're trying to change period pants, that could get a bit complicated. A lot of people were using a pad inside period pants as well, so maybe the pad got removed, but the pants didn't. And other simple things to help people orientate sort of where the front of the period pants is even just, sewing on a bow or some identifier that sort of helps the young person be more independent, and so they don't, put them on inside out. Another thing I think is caregivers seem to be doing quite a lot of the other, I guess, care aspects, like washing out period pants, and they thought if they didn't do that, then they wouldn't be able to necessarily see how much blood came out in them, and therefore not know exactly how heavy a period was, or be able to monitor them. And simple things can be done there, like, yeah, asking your young person to wash out their pants, but being there with them so you can still see. So it's sort of gradually increasing independence with little steps based on the level that's appropriate for the age and stage of the young person. But just, yeah, giving them a little bit more independence bit by bit. And then I think for teachers and support workers, again, is just realizing how much people can do themselves. Um, yeah, I think that's probably a good start.
Yeah, definitely. And like every other process, biological process, life process, being a part of supporting that person to, manage those changes appropriately and scaffolding them with communication, everything that we're already doing around, you know, life and growing up. So yeah,
Mhm.
that's great. So research is always really good at telling us where we need more research. So where did your research identify gaps in like health services, or like we talked a little bit there, school support or educational materials that we can give young people
Mhm.
with Down syndrome?
Yeah, so yeah, there are always gaps, and I think the point of identifying gaps is to know, what needs to be done.
Mm.
Not always saying we need more research to answer some questions. Sometimes we do just identify gaps, and then we can start to fill them. So in terms of healthcare, there did seem to be a bit of a gap in terms of guidance on decision making around use of hormonal medication.
Mm.
So a lot of caregivers felt that they were sort of left to almost fend for themselves, in the sense that options were presented, but it was difficult to sort of decide what to do, and they didn't feel that there was enough support there. So I think that some resources and potentially training for clinicians would be useful, but resources also to help guide some of those decisions. It was quite a complex decision for people thinking perhaps you're taking a decision on behalf of somebody else, and there's a lot of ethics around that, and then people worrying about whether that's helping manage pain and symptoms of heavy periods perhaps in the short term, but what would the long term health effects be? So just more information generally around hormonal medication would be really useful for people. In schools, yes, I think we interviewed several people working in special schools, and also many of the young people that we interviewed were attending special schools. And generally, they seemed to be really good at providing support. They're often used to helping support personal care. And I think there was that gap in mainstream where if support was needed, it was often the parent who needed to come into school and assist for a number of reasons. But I think perhaps there could be some more crosstalk between the school systems, thinking a little bit more about that. But there definitely at the moment seems to be a bit of a gap in for girls in mainstream schools. And then in terms of educational materials, definitely there's a lack of tailored materials for our young people. And some of this is not just the lack of existence of materials, but just lack of dissemination and lack of awareness of what's already out there. But I think even within what's already out there, there's still some additional areas where there could be more information around, some of these small steps towards supporting independence. And people were really keen, young people and their caregivers, to know more about how to support independence, as well as more information on hormonal medication and practical menstrual care for both caregivers and young people.
Wonderful. Thank you. Yeah. So, like, how important do you think that early preparation is for menstruation education for girls with Down syndrome? Like, do we know yet what approaches work best when we want to prepare?
I think we can learn a lot from the approaches that have been implemented in special schools, and from some of our specialist Down syndrome educators. And I think it's some of it will be translating that into a sort of more mainstream settings. It was interesting actually when we thought and talked to people about early preparation, in a sort of talking at home, about periods. So for some people, it was difficult. It wasn't a deliberate lack of preparation. It was an inability to really prepare for something that hadn't happened yet. So, it's a bit of an abstract concept for many of our young people to really understand something that they haven't experienced. So to some extent, preparing in that sense, it can be quite challenging. But people were still preparing by starting to sensitize around pads and panty liners, and just getting young people to start wearing them so that they got used to them, as well as sort of having kind of open conversations and open door type of policies at home so that the young people could watch their mother or maybe an older sister, and understand a little bit more about what a period is. I think another thing that's important and that perhaps was done better in special school settings is really beginning to give our young people some of the language that helps them talk about their emotions and pain and the parts of the body that pain is felt in. So just even simply, and not just even about menstruation, but just thinking about body parts and emotions, and all those things that help facilitate communication about needs. And then also one thing we saw was those using AAC devices to aid communication, they didn't have symbols. So just simply preparing by having the right symbols to be able to, again, facilitate conversations would be really useful.
Excellent. Giving people a vocabulary, so to speak. communicate. Wonderful. So, what did our young women with Down syndrome themselves say when what did they want to tell adults and professionals to understand better? What was their message to the world?
That they can do it was one of the key things. And the other, I think they were really keen to sort of share experiences with their younger sort of younger people with Down syndrome and let them know that it would be okay. They talked quite a bit about pain and pain management and sort of saying, when you're in pain, you should, think about the foods you like to eat and maybe take a heat pack and maybe rest a bit more and do the things you enjoy or watch television, relax. So a lot of what they wanted to share was about, really supporting people who don't have their periods yet, which was really nice. And generally saying, it's okay. They didn't like their periods, but I think a lot of people don't. I don't think that's entirely surprising. But they also really felt that, they wanted people to understand, that periods equal pain, right? And were yucky, and they didn't enjoy having them.
It's lovely to see that mentorship and sisterhood happening there
Mm,
as well in our community. Um, and anything we can do to help dispel shame around this normal part of life, it's really important. So, from a funding perspective, why is research in this area so important? And like what wider social or health benefits could come from better support?
Well, yeah, research is really important in this area just because, without it, we don't know what people's needs and challenges are. So then that makes it challenging to make sure that people have the support that they need. So if you haven't done some research to really understand the range of experiences and not just what the challenges are, but who's experiencing those challenges, then nothing can really change, nothing can improve. It's just sort of more guesswork. So I'd say, research in this area it's been really essential. And you say, what benefits and wider benefits could come. Well, I think, menstrual health, and even in the definition of menstrual health, it's not just about physical well-being. It's about, emotional well-being as well. And, improving menstrual health can contribute to, as well as improved knowledge and confidence in being able to communicate needs and understanding one's body. It can contribute to improved independence as well as sort of emotional and physical well-being. And I think also really improving the well-being of caregivers as well, because if our young people are better supported and become as independent as is possible for them, then that really relieves some of the burden on caregivers. And while they were very clear in saying, this was part of their role and they didn't resent, supporting at all, it was still taking a toll. And I think, the more that can be done to support families and as well as young people, the better the mental health and well-being of our caregivers, which is therefore only good for our young people.
Absolutely. Absolutely. So, what are the next steps for this research? And like what kinds of partnerships or funding would help turn the findings into real world sort of support
Mhm.
resources?
Well, we do plan next steps. We're not just going to say that, we've described the situation and that's it. You said earlier something about, researchers are very good at saying we need more research. I'm going to say that in one area, yes. I do think we need some more research, and that's really around the presentation and communication of menstrual pain and thinking a little bit more about pain and how we can understand what people are really experiencing and both from their side, helping people be able to communicate their pain better, but then also thinking about clinicians and others working with our young people and thinking how they're better able to identify pain, because caregivers really were using a lot of their intuition and saying, they sense from a change in behavior or by observing other aspects of their child, that they know that there's pain there. Like if they love dancing but they don't want to dance, they know that that's linked to pain. So I think we do need some more research on pain and really thinking about how that research can then be practically used in the interventions we would develop. And then the other key thing that I think we need to do to turn this into real world support is develop intervention content. So some of that's going to be about better dissemination of existing resources, not just reinventing the wheel, but then also developing the resources to fill some of the gaps that we have found in this research, and making these tailored resources that are appropriate for different cognitive levels. So practical tools to aid independence and guide on menstrual care, communication about pain, hormonal options, some of the things we were talking about earlier, as well as some clinician training. So really encourage these holistic conversations about menstrual health, and perhaps also creating more supportive networks and maybe opportunities for peer-to-peer conversations to facilitate learning that way as well. So whatever intervention would be created, we would then need to pilot that, look at feasibility and acceptability of the content, think about where and how interventions should be delivered, and then look to scale up. So I think there might be some partnerships, you say, with schools, and thinking about what could be done in schools, but then also thinking about community organisations and peer support, and how the two together could really lead to an intervention that would improve menstrual health for our young people with Down syndrome.
Wonderful. With the heart at the heart of your research, as always, Katie, the voice of the people who are affected or involved as well, which is great to see. Okay, thank you so much for speaking with us and telling us about your work and what you've learned. And I can't wait to see what comes next. And as usual, thank you so much for working on improving the lives of people with Down syndrome. And best of luck for the future.
Thank you. Thank you for having me, Liz. We have a preprint, so that's the academic paper that describes all of our results in detail, and other aspects of the study. That's available while we're waiting for peer review in journal and publication. So there's a preprint which I believe you'll be able to link to with the QR code.
Wonderful. Okay, thank you, everyone, and have a lovely day.